Well, here on Tuesday, right in the lunch break, we've got David Ashford, Minister for Health and Social Care. Lots of things happening in the Chamber this morning, especially with the regs. Complication, I think, was how some of the MHKs were putting it. Far too complicated. They didn't understand it. How could they deal with it when they don't know what it actually meant?
We've got to remember with the regulations, they are ultimately the legislation. So in the event we need to prosecute someone for breaching the regulations, they've got to be of a quality that will stand up in court. There is guidance that flows off the regulations. There's been guidance on the website for several days. General travellers have their isolation rules, and it's done into categories.
Who needs to understand it? The politicians, the police?
Ultimately it's the courts if there is a prosecution. Right. So legislation has to be of a certain standard. It can't be woolly, it can't be vague, because if it is, then basically you will not get a successful prosecution out of that.
So you're happy with what was written there?
Yeah. And we've got to remember that what flows off the regulations as well is people get individual direction notices. So depending upon your circumstances, you will get a direction notice, and that direction notice is what tells you what you need to do.
I mean, you're happy with what you got there then?
Yeah, I think you couldn't make it any more simpler, because if you make it more simpler, as I say, that introduces potential confusion in there from the fact that it's too woolly. So as with all the regulations we've been brought forward, it is complicated. It's not simple.
Now we're getting a lot of pushback from people who have got caught up in this thing between the new lockdown and the old lockdown. What's the word I'm looking for? Isolation when you come back and that sort of thing. Any sympathy for these people who got stuck in the middle of these?
A great amount of sympathy. I mean, it's been a dreadful time for everyone, to be honest, over the last 12 months. It's been stressful. People have been separated from family. They're trying to get to see family. The problem you have is the law has to begin and end somewhere. A line has to be drawn.
You have made a retrospective in the past on certain things, haven't you? I thought
not in relation to the actual direction notice, right, because the issue is what happens is when someone comes back, they're issued with a direction notice. Now that direction notice under the law has the full force until it expires. What will need to happen to make it retrospective is we will have to go back and reissue all those direction notices. So people will need to be advised. We also have, of course, the situation where people may have travelled further than the UK. Now, if they've gone out of bounds of the UK, then they won't get the 7-day quarantine. It's 14 days that they've got to comply with. So the team will have to go back and check people's travel history as well. Now, at the moment, that's probably not too bad, because it's been 5 days since the regulations came in. So there'll be a whole batch of people who are under the old rules that now no longer are, because they'll have finished their isolation, so the numbers will have decreased. But certainly if we'd done that last week, we would have been several hundred people minimum that the team would have had to go completely back, check all of their travel history and apply to. It's a fundamental principle of law generally that law isn't retrospective. There are circumstances where sometimes it is, but the general principle is a law applies from the date that it comes in.
So people can get on a plane and go over there and come straight back, and they're under the new rates.
And that is one of the bizarre things, I've got to admit, with it. And people have found weird and wonderful ways over the last 12 months to change the regs to their circumstances, and this is no different.
How's it going now with Manx Care and all that sort of thing in place now? Teething problems and things going on, I hear, or are you happy with it?
Not to my knowledge, Paul. You know better than me.
I was flying quite slightly there, I suppose. I was hearing things, but nothing very concrete.
I think the Manx Care situation is going very well. Right. They've got a grip of the situation.
But they want more money from government, don't they?
Well, it's a constant.
That's
battle.
what you were doing, anyway.
Well, also we've got to say. I mean, I did trail this a couple of weeks ago, where I said quite clearly that we would have to deal with waiting lists. I stated in Tynwald that the waiting list time is unacceptable.
Was it nearly 5 years in one case?
We've got to remember that's the extreme case. That's not the average waiting time.
But that's the one that gets headlines, isn't it?
It is, assuming that weight is correct, but we'll have to wait and see.
You look into it. Oh no, you don't now, do you?
But no, that's for Manx Care. But in relation to the waiting lists, I said quite clearly in Tynwald something needed to be done, and there will be a business case brought back Manx Care through the department, because it has to go through the department first. who then will be forwarded to Treasury.
So every time there's a question in future asked about the health service, you can't answer it directly. You
No,
have to
I
go back to them.
No, I can.
You can.
As Minister, I am still ultimately responsible.
Right.
And
So you got your finger on the pulse still.
And all Tynwald questions will still go through me.
It's just this sort of extra layer of bureaucracy, it seems to a lot of people. That's all.
Well, no, it's important that Manx Care, if anything, it's removing bureaucracy because it's ensuring that Manx Care focuses purely on the delivery of services. Mm-hmm. That's what Manx Care is there for. They are a body that will only look at delivery of services. What we had previously would actually, in my mind, class as bureaucracy, which is where we had people trying to formulate policy and deliver the services, and that caused, from my point of view, confusion and red tape.
So at this moment, Alf Can's got a proposal for, is it millions, £4 or £5 million extra?
No, nothing has come forward yet. A business case is in the process of being drawn up.
4 or 5 million?
We don't know yet because it will need pricing, because it will also depend what's out there, because as I've said before, the problem is it's not going to be something that's going to be fixed overnight, because our support network is the UK. And the UK has similar issues to us with waiting lists. They have exactly the same thing. If anything, theirs has been exasperated because we did have a period last year where our services were operating as normal. The UK hasn't had that. So obviously their focus is going to be on getting their own waiting lists down. So the level of support we can pull in to bring our waiting list down will be much reduced.
How's this treated though? You're going to just fill the void, the overspend, or you go for more money to get above this situation so you don't overspend again?
Well, it's not an overspend, Paul, because Manx Care can only spend the money they have.
So you have to.
They can't spend outside of their budget.
Right.
So if they want to go forward, as we do as a department, in looking at waiting lists, then we will need to go to Treasury with a business case
for
approval.
And then you want more money anyway, right? On this
no, we're not in deficit. We met our budget last year.
Right. But there's always money being called for. I mean, every year, more money is required, isn't it, from
and
Treasury?
That was within the Sir Jonathan Michael review that actually said even with cost controls, health would grow at an average of about 4%, 4.5% per year.
Are you relaxed then that people hopefully will not see those sort of waiting lists forever? Taking in what you've already said about the UK, once they can get themselves together, you think the Isle of Man can follow suit, reduce these waiting lists?
Yes, I think there's ways and means of doing so, and it doesn't have to be multi-million pound waiting list initiatives as was just been described there. There's other things I think we can do as well, and other support services we can use, but let's see what comes forward from Manx Care, because they are the operational delivery body. It will need to go through the department first and then on to Treasury.
Because obviously I understand some things have to be done in the UK, but you could obviously take on more people here, which negates the need to go across. Things done here, it's better or cheaper, and it's certainly under the current situation better for the patients, isn't it, not to have to go through any isolation?
Well, we need to be careful, because with volume and everything else, it isn't always necessarily cheaper, because of the volume of throughput you can do in the UK, but that differs service to service.
I mean, in the past you brought somebody in for a period almost, and they've done hips or knees or something, really
But again, though, you're dependent upon theatre time here.
Yeah.
Because there is limited capacity theatre-wise. If you're using the theatres for one thing, you're not using it for another. So again, it swings and roundabouts. It will depend upon the speciality, and one low waiting list initiative that works for one speciality might not work for another. So the business case needs to be built up, not just saying we want this amount of cash to deal with it. It will be divided down into the specialities.
How are we doing with unknown cases or cases you can't track back? There was one over the weekend, wasn't there, something? So where are we up to now?
There was. Well, I think contact tracing is still taking place in relation to that one, so we'll soon know whether it is completely unknown or not, but it's encouraging signs because nothing else has emerged. There's no other unexplained cases that are popping up, but we are going to see this from now on, and we need to be clear about that. That's not something to now be concerned of in the way we were a year ago, because we are going to see cases emerge in the community, and we are going to see unexplained ones. And that's a fact of life.
An interesting move, because there hasn't been a rush to Tesco for toilet rolls as much. No one seems to be, going into sort of, I don't say mass panic, but just worry or whatever. This is the sort of new normal, and this is what you expected to see now, is it?
Yeah, I think people are slowly adapting. There is quite rightly still worry out there. I mean, but
it's going to be there.
It's going to be there, and there is, but people I think are starting to come round to the idea now that COVID is with us. COVID will be with us forevermore. the vaccine rollout is going exceptionally well on Ireland. We've managed to protect those who are most vulnerable.
Right. 15,700 I think was the last I looked at it for the second jab.
Yes.
Is that really as good as it should be at this moment?
Because don't forget we moved everyone to the 10 weeks, so it's from the 10th of May that the second jab actually starts rolling out. So we moved to the 10 weeks and then to the 12. So from the 10th of May, that's when the second jab uptake will tick up. And
people will be contacted, will they, for their second jab?
They've already got it, Paul. The second jab is, as we've said before, with your appointment, I hope you're trying to find your date.
I'm looking.
Because
it's exactly, 12 weeks, isn't it?
The second day, well, it depends when you were, Paul. You might have been in the 10-week bracket, but it should be on your card anyway.
But seriously, I mean, some people might not have it either. So will there be any means of finding out when your second jab should be, or is it?
No, I believe you're told at the time, and it's on your original booking.
Right. Just to finish this section, are you confident now that we are going to come out this on the 28th of June still? I mean, wasn't it the latest we had? I mean, nothing to shift it earlier or later?
No, I try not to make predictions, Paul, you know that. I think I said in Tynwald the other week that, that this has had more twists and turns than a Hollywood blockbuster over the last 12 months. So I'm not going to predict what the situation is going to be at the end of June. What I would say is it's looking exceptionally encouraging. We are heading in the right direction. There are many people who have taken up the option for family to come over. We hope for a further release, possibly down to level 2 at the end of this month, so only a few weeks' time. But let's see where things take us. I don't like to make predictions in that way. I think we've got to follow what the evidence is at that time.
Obviously, the pressure of the UK is they're going to start having holidays, possibly it might be just Portugal at this rate, but something could happen on the 18th, and here we won't be able to, because unless you change your mind or whatever.
Well, people are still able to travel off Ireland.
It's coming back is the problem.
There was nothing to prevent. They would have to isolate and abide by the rules when they return.
Which you can see the people in the UK coming back and don't have to. It's going to be a sort of...
Well, we'll see if the UK goes down that route. That's there's rumours in relation to that, but nothing has been formally announced. And even then, it might be limited to very specific countries. You just mentioned one of them. But no, it's encouraging. The important thing now is we have to start the journey back to normal life. People have done exceptionally well over the last 12 months. They've done what the lockdowns intended, which was to protect the NHS initially, and then this year to protect the vaccine programme. They've been, the Manx public responded and allowed us to do that. And now we need to start moving back on with normal life.